Saturday nights at the Alfred are often filled with victims of assaults or car crashes. Less common are the everyday domestic mishaps.
I slipped on my kitchen floor. Very simple. Just slipped over, hit the door frame.
Cassandra has dislocated her shoulder.
It is hurting. It's hurting quite a bit.
Ready, steady, that's it. How's that? Is that okay? All right? We're going to look after your mum, okay? Don't need to worry.
Nurse Michelle's first priority is to relieve the pain.
What I'm going to do is I'm going to put a drip in your arm so we can give you some morphine for the pain, okay? And then we're going to put the shoulder back in place, all right? It's a very, very painful thing, shoulders. Most painful thing that you can have done.
Can you move my arm for me? It's really hurting.
Yeah. If it's supported like that, is that better?
Bit, yeah.
Do you want to come around here and hold your mum's arm? And I'm going to go grab some morphine. That's it, just exactly how it is. Just hold it like that. Wonderful.
Like this?
Yeah, good help. Wonderful. Lovely. I need a doctor to trauma 1, please. Doctor to trauma 1.
Steve is having a heart attack. One of the arteries bringing blood to his heart is blocked. Surgery could take too much time.
And every sort of minute we waste at the moment, it's ischemic time for your heart, so bits of your heart muscle are dying, so we need to act quite fast. So I don't think going to the lab at the moment is going to be the right thing for a potentially fiddly procedure which could waste 3 or 4 hours. The other option is to give you clot-busting medicine now and try and dissolve the clot.
But the clot-busting drug carries a risk. In some cases, it can cause fatal bleeding in the brain.
What do you think is the safest and best option?
The best option right now is the thrombolysis.
Is the blood
Is the clot busting
thing? Yeah.
Absolutely.
Oh yeah, because we need to act quickly.
Yeah, I think we do need to act quickly, and I say if we take him upstairs, and it's a potentially difficult procedure, and it could take a while before they actually access that vessel and treat it, and I think that's time that we can use dissolving the clot down here.
Okay, whatever you think's the best, we have to leave it in your hands.
Okay, there's nothing to worry about. You're doing really well.
You'll be good, Dad.
Yep, we'll take good care of you.
That's it, just relax.
Where's Rob?
The decision has been made. There's no time to take him to surgery.
You're better now than what you were an hour and a half ago, doll. Much better than you were.
So we're going to give him some clot-busting medicine, which hopefully will break down the clot in the next hour or so.
Okay. Yep, I'll put him on.
Mark, sure. All right, mate. Yeah, okay, we're going to thrombolyse him now. His blood pressure's okay. So it's going in the next 5, mate. All right, cheers, mate. Bye. So that's just the cardiologist saying they're happy with our decision to go ahead and thrombolyse him and not waste any time with a lab at the moment. And the cardiology consultant's been contacted, and that's his opinion too, that we thrombolyse and not waste any time with trying to get him up to a lab.
The drug will thrombolyse the clot. It'll thin Steve's blood and dissolve the blockage in his artery.
The clot-busting medicine's in, and it should be going to work now on that clot, so hopefully that pain in your chest is going to go away. Now, if you feel funny at all, you give us a shout, all right? And certainly if that pain comes back, you give us a shout.
The risk is that Steve's thinned blood could cause a hemorrhage inside his brain. Outside the emergency and trauma centre, an ambulance that has only just delivered a patient has been called out again.
So we've just been dispatched to a 21-year-old male, history of diabetes, who's unconscious. So most probably hypoglycemia.
Hypoglycemia is when there's not enough sugar in the blood. The heart rate speeds up and brain function slows down. Left untreated, the patient can lapse into a coma.
If it's prolonged, it can be fatal, so very important to rectify quickly. I'd probably say most diabetics have experienced some level of hypoglycemia. Some never get to be unconscious because people are around and notice that their conscious state's going off a bit and give them some sugar. But particularly if they've been alone and people will come home and find people in an altered conscious state or unconscious and call for us.
Paul and Mark will need to measure the patient's blood sugar level. If it's too low, they'll insert a drip and put a sugar solution straight into his blood.
G'day there. How you going? And what's Lee's past medical history?
Diabetic.
Yeah. Lee, how you going?
Not too bad.
Not too bad. Do you know where you are?
Yes, at home.
Okay. Your friend here's concerned because I think your blood sugar's dropped quite low.
He had a fit.
Oh, he had a seizure? How long did that last for?
Maybe 2 minutes.
2 minutes? Okay. Have you seen him do this before?
I've seen his blood sugar drop.
Okay, and you've given him some honey and stuff, have you?
Yeah.
Has he taken that okay? Or?
He had a full jar of jam.
How are you feeling?
Lee's friend Ian tried to pump up his sugar levels by feeding him an entire jar of strawberry jam.
Lee, just going to check your blood sugar levels, all right? Just give us your finger there. Sharp sting.
Where have you been out to today?
Lee's dazed and confused condition is typical of someone with low blood sugar, but that's not what the test is indicating.
It's come through as high.
You're not quite right at the moment, are you?
No.
Hey, can you see it?
See what?
The wonderful possible. Say thunderstorms give you asthma, so you make it your mission to tame the clouds with a mad invention.
No way.
Yeah, for real.
What about a PhD at 80?
Still got it.
Pop-up law clinics anyone can access?
Nice.
Or lifting others up through education.
Yeah, I see it now.
Yeah, you do. Deakin University. See the wonderful possible.
Get ready for game day. With Coca-Cola 30-pack varieties for just $28 each, save $22. That's just 94 cents per can.
A slip in the kitchen has dislocated Cassandra's shoulder.
Yes, we're just getting dinner ready. About to dish up roast chicken and all the trimmings.
If there's a fracture around the shoulder socket, Cassandra may need to be taken to theatre to have her shoulder relocated.
Thank you. Let's go. Can you come up with you?
The news is good. There are no fractures.
The top part of her arm's actually popped out from the shoulder joint, so it's a dislocation. So I'll try and get that back into place. I'm going to give you some more medication, pain relief, and also to make you a little bit sleepy. All right? Louise, are you going to sit outside for this?
Yes, she is.
Right.
So you wait outside, okay? Okay.
Good girl.
For her shoulder to pop back in, Cassandra's muscles need to be loose and relaxed.
The looser they are, the easier it is for me to get everything in. All right?
Consultant Gim Tan offers Jyoti some support.
How'd you go?
I just really started the contraction.
I think it's a leverage.
Relocating a shoulder safely can be tricky. It's not something that should be attempted at home.
How you going? It's hurting, is it?
It's okay, you just nice and relax. Have a sleep. Make it nice and floppy.
Jyoti relocates the shoulder on the first attempt. The relief for Cassandra is instant.
Ready? Let's go for something. How's it feel now? Better? Yeah, don't worry. Stop. Okay, no.
What?
Stop. How do you feel? Does it feel better?
Less painful?
Fantastic. Very good.
It's just about keeping those muscles nice and loose, keeping her calm and putting a bit of traction on, and it eventually popped in. Well, I hope it popped in. I'll find out from the x-ray in a second. Fine. Happy with that? Is that okay? I did. It's all done. Don't you remember it? No. You don't remember? I don't want to remember. Excellent.
That's a good job done then.
Yes. Very pleased.
21-year-old Lee is a diabetic. He's just suffered a seizure, which could be the result of low blood sugar, but a measurement of his blood sugar read high.
Might just do that again, because I don't reckon that could be...
a bit odd, isn't it?
Yeah.
I'm just thinking maybe it's a poor reading. Generally a high reading comes on over a long period of time, whereas the low blood sugar can come on reasonably quickly.
A normal level should be around 4.5. Anything under 3 is dangerously low.
5.2. So his blood sugar is coming up from the honey that he's been given. So
it appears the first reading was wrong. The sample may have been contaminated by traces of food on Lee's finger.
Yeah. What's troubling you at the moment? Have you got some pain?
Not pain, just...
You're just shivering and things like that? You don't look 100% to me. Yeah, so I think you better go to the hospital and have a quick check-up.
Lee's been stabilised, but he'll need to go to the Alfred for more tests.
I'll just give you a little bit of oxygen on the way in, all right? Might make you feel a bit better. The brain's very sensitive to low levels of glucose, and sometimes people fit when it gets a bit low. But his friend's done the right thing, giving him a whole jar of jam to eat, which I don't know how he tolerated that, but he did, and it's obviously worked and got his blood sugar back up to a normal level. He's still a bit drowsy and feeling a bit unwell, but given that he's never had a seizure in the past, it's good to have that investigated in hospital.
Heart attack patient Steve's been given a clot-busting drug to clear a blocked artery. The risk is that it could trigger fatal bleeding in the brain.
These ECGs that we've got here show that the changes that we saw, which are representative of a heart attack, they're coming back down to normal. So we think that the clotbuster's working.
After an hour, the drug has taken effect, and Steve's out of immediate danger.
Hopefully in the next half an hour we'll be able to get him up to the cardiology ward. Good work, team.
The drug's restored blood supply to the heart, but it's not over yet.
I don't think his artery is fully open yet from the clot buster that we gave him, but it is obviously a lot more open than it was when he first came into hospital.
Yes.
There is still some danger there, but we're taking him up to the lab tonight.
Yes. Okay, to do the
angiogram.
To restore full blood supply to his heart, Steve is taken to the catheter lab to have the artery opened. Doctors will be operating on Steve's coronary artery by remote control. And throughout it all, Steve will be wide awake. Downstairs in the trauma centre, an orderly is bringing in a newly arrived patient.
Oh, that looks terrible.
That doesn't feel good either.
Oh my goodness.
It's one of the more unusual cases.
When did it start?
Marguerite is bleeding from the eyes.
You know why it's coming out of your eyes?
Yeah, because there's no more room for it to come out of my nose.
That's right, and you're pinching it so hard.
But it's also coming out of my ears.
And can I also have a gluten-free beer? What's that?
That, my friend, is 2Bay's gluten-free beer. Australia's friendliest beer. 2Bay's. It's the shout that doesn't leave anyone out.
Stay ahead of the game with Better. For the NRL Grand Final between Storm and Broncos, get $6 for either Cam Munster or Reece Walsh to win the Clive Churchill medal.
Imagine what you could be buying instead.
Were you late to get Josh again?
I wasn't late. Okay, here's the deal. I was about to leave work and it came to me. Today was training. Sport mode, boom. Tunes on. 360 camera clock the target, right on time. Kick the sensor, bags in, dirty boots in the front, ventilated seats on, mission complete.
He was late.
But did you pick up the eggs?
Behind this bathroom door lies a lot of fatherly patience and a little QV bath oil, both of which go a long way. QV, care behind every bathroom door.
Okay.
Marguerite seems to have a terrible condition, but the cause is simple. It's a nosebleed.
It looks worse than it is. She's, there are little basically just little connecting ducts that join with the eye, and the pressure from holding her nose so much as it's still bleeding, it just builds up and it comes through the little ducts here, right in there, and actually out here. Another direction the blood can come out through the eyes. When we take her hand away, it just hoses out of her nose. So I'll get the ENT tray.
Hello, how are you?
Not good.
No, my name's Rob. How long's it been bleeding like this?
Over an hour.
Over an
It's
hour?
coming out like crazy. I must have lost quite a bit of blood.
Yes, okay. What we're going to do is pop a drip in your arm and take some blood tests, and we'll have a look in your nose and
Can't
see
you
what we
take
can...
some blood from here?
Yeah.
Marguerite's on a drug called warfarin for a heart condition. The tablets thin the blood, reducing its ability to clot. So a small nosebleed can quickly become a much bigger problem.
Why do you take the warfarin tablets?
Well, I have an implanted cardiac pacemaker and I have a homographed Colbury valve.
Warfarin is basically a tablet that's given to people when they've had heart surgery, valve replacements, pacemakers inserted, any sort of foreign body in the heart. They want to make sure that the blood flow is flowing around it at all times. A lot of times this is what happens. This is why it's so closely monitored by people's GPs. Sorry, darling.
Stopping the bleeding by getting the blood to clot won't be easy.
Just let go of your nose, darling. Let me see if it's... Whoop.
In the catheter lab, heart attack patient Steve is going to have his artery unblocked. The first task is to find the blockages. A tube or catheter is inserted into an artery in Steve's thigh.
It's specifically designed to get access to the coronary arteries from the femoral artery down here, and that'll come up in a perfect shape to engage the main coronary artery.
The catheter is carefully pushed through the artery until it reaches the heart. Once it's in place next to the heart, dye is injected into the artery and an X-ray reveals where the blood is flowing.
So Mr. Savannah, this is the catheter coming up from the groin, up around to the arch, and injecting dye into this bypass graft. And the graft looks fine along here, but you can see here it's pinched and narrowed, and there's some blood clot there beyond there. So that's the area that caused the heart attack for you last night.
That blockage isn't the only one around Steve's heart. Another one, at the top left of the screen, is also of concern.
So far we've found that he's got severe disease in his native system, the ones he was born with. He's got the left main vessel, the main vessel supplying blood to the heart is very tightly narrowed. There's another branch up that's completely blocked, and his right coronary is completely blocked. We found at first the bypass grafts, which looks fine. We're going to find the other ones now.
If the blockages persist, Steve will continue to suffer heart attacks, and one day he might not get to the hospital in time.
Right. What are your veins like?
This is not the way I envisaged being on television.
I know.
Not that I ever envisaged being on television, I must admit.
Marguerite's blood isn't clotting because of a heart drug she's taking.
And management of warfarin is not a static thing. People's doses vary. They can take a certain dose one day and a higher dose the next day and go back to a lower dose the following day, just because, I mean, it's not something that's given as a standard dose, then left alone. It's really got to be monitored closely.
So how many towels do you think you might have soaked through at home? Just the one, or do you...
About 3.
About 3, okay. So it's hard to know how much blood that she's lost, but we'll just check everything.
Whatever the emergency team does, they can't seem to stop the bleeding.
My name's Jackie. They're thinking about getting the special nose doctors in to have a look as well. At least if it comes out the front of your nose, it comes out the front of your nose and doesn't go in your tummy and make you vomit it up later.
Yeah, I know, but it's just pouring out.
It's not too bad. It's dripping, so just leave the towel there and the towel will soak it up. Okay? Yeah,
with the blood flowing so freely, it's impossible to find the exact source of the bleeding. And she's already lost close to 10% of her blood volume. Heart attack patient Steve is awake and alert as surgeons prepare to unblock his artery.
The main vessel that's the problem is his right coronary, or the bypass from his right coronary, which is going on to another vessel, which is really the problem. So we'll go ahead to fix that.
First job is to use a catheter to insert a balloon into the artery.
So the balloon, you can see here, is inflated. It's about 10 times atmospheric pressure, and that will basically compress the cholesterol plaque against the wall. And then we'll put in a scaffold, which we call a stent, which is a stainless steel mesh, which holds the vessel open. You can see the stent in here. Can you see the little stent? So, as I explained, it's made of stainless steel and it's got a drug coating on, which will hopefully prevent any re-narrowing in there.
The stent is also inserted into the artery using a catheter. When it's in place, a balloon inside the stent is inflated and the metal mesh expands. When the balloon is deflated, the mesh stays put and the balloon and catheter can be pulled out.
But we're very satisfied with that result. We'll pull the wire out now and we'll take a few more pictures and I think we're done. So Mr. Savano, this is the same segment. You can see we've opened that up nicely there. So that blockage is gone.
So how many stents did you put in?
Just today we just put in one stent. You had 8 vessels we had to look at, but this one was the cause of the problem.
Dive for some food and drink.
The procedure took 3 hours. 2 days later, Steve has a lot more colour in his face.
So how are you feeling after the procedure?
Top of the world now, because I got my food. They've done workers, they worked miracles on me.
Steve stayed in hospital for a week. He's still at risk of further heart attacks and he'll return to the Alfred in a month to have another stent inserted. Lee, the diabetic, was checked over and declared safe to go home. He's vowed to keep a closer eye on his sugar levels and take his insulin on time.